Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on my top 10 things to do if you have an upper respiratory infection. URIs are typically caused by viruses or bacteria, the most common viruses being adenovirus, rhinovirus, influenza, COVID, RSV, among others. And the common bacteria that can cause URIs include strep throat and bacterial pneumonia. URIs can cause a variety of symptoms, including fevers, chills, coughing, sore throat, congestion, body aches, and joint pains. URIs are very common, and they can cause relatively mild symptoms, or they can cause very severe symptoms and put you in the hospital, and maybe even kill you. So this is a really important topic that you need to know about. Now, if you like content like this, be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos. In addition, if you have any questions, leave them in the comments and I will answer all of them. Now, before we get started with the URIs, remember that these videos are for educational purposes only. I cannot give personalized medical advice here. So if you're suffering from a URI and you're not sure what to do, make sure that you go to see your doctor right away. Now, let's get started with my top 10 things to do if you have an upper respiratory infection. Number 10, isolate. Isolation is optional. It's no longer mandatory the way that it was during the height of the COVID-19 pandemic. However, URIs are extremely contagious, and isolation remains one of the best ways to protect the rest of the community. If you do decide to isolate, a good time to come out of isolation is if you've had no fevers for 24 hours and if your symptoms are significantly improved. You don't have to be symptom-free in order to end isolation, but at least you want your symptoms to be significantly improved. Number 9, vaccinate. We have excellent vaccines to prevent many upper respiratory infections. Vaccines make it less likely for you to get infected with a particular upper respiratory infection, and they also make it so that if you do become infected, it will be more likely to be a mild illness as opposed to a severe illness that could put you in the hospital. We have excellent vaccines for COVID-19, influenza, RSV, and bacterial pneumonia. So if you become infected with one of these upper respiratory infections, once you've recovered, if you're due to receive one of these vaccines, make sure that you receive it right away. That way you'll be better protected from contracting this illness in the future. Number 8, use over-the-counter cold flu medicines. Medicines such as Mucinex or Dayquil-Nyquil can be very safe and effective at relieving your symptoms when you suffer from a URI. These kinds of medicines typically have multiple active ingredients in order to provide multi-symptom relief. And these include acetaminophen, which treats pain and fever, phenylephrine or guaifenesin, which are decongestants, or dextromethorphan, which is a cough suppressant. Over-the-counter cold flu medicines typically have one or a combination of these kinds of active ingredients to help to relieve your symptoms. And because they're so effective, I recommend that you give these a try if you're suffering from an upper respiratory infection. Number 7, test yourself for influenza and COVID-19. We currently have home test kits, which are cheap and easy to use, and they will test you simultaneously for influenza and COVID-19. These home tests are available at grocery stores and at pharmacies, among other places. And using one of these tests is one of the first things that I want you to do if you're suffering from an upper respiratory infection. If you test positive, make sure that you notify your doctor right away because your doctor may want to prescribe prescription antiviral medicine to help to cure your infection. In addition, if you test positive, you'll want to consider staying home from work or staying home from school in order to keep everybody else safe. Number 6, wear a mask. Wearing a mask is still one of the easiest and most effective ways to prevent the spread of upper respiratory infections to others. The mask acts as a barrier, which will prevent the virus or bacteria from spreading to others when you cough or sneeze. And in addition, it sends a message to everyone else around you. When they see that you're wearing a mask, they're likely to know what that means, and they will probably keep their distance from you in order to prevent them from getting sick. Because of how simple and effective masks are, I do recommend that you wear a mask if you're suffering from an upper respiratory infection. Number 5, check your vitals. In many cases, when you have an upper respiratory infection, your vitals will be fine. However, if your vital signs are abnormal, that is a strong indicator that you need help, that you need to go and see a doctor, or maybe that you need to go to the hospital. Use a blood pressure cuff to measure your blood pressure, and it will also tell you your heart rate. You can use a thermometer to measure your body temperature, and you can also estimate your breathing rate by counting how many breaths you're taking in a minute. If your blood pressure is much higher or lower than what it typically is, or if your heart rate is slower than 60 or greater than 100, or if your temperature shows that you have a fever, which is at least 100.4 degrees or higher. If any of those things are happening, then you have abnormal vitals and you should get help right away. Number 4, wash your hands. Washing your hands is one of the most effective ways to prevent the spread of upper respiratory infections. This is a really healthy habit that all of us should do, but it's especially important when you're sick. Wash your hands after using the restroom, wash your hands after touching your face, and wash your hands before leaving your home. Make sure that you wash your hands on a regular basis in order to protect your loved ones and to prevent people in the community from getting sick. Number 3, consider seeing a doctor. Visiting a doctor can be one of the best things for you to do if you're sick with a URI, because a doctor can do many things to help you, including checking your vitals, ordering laboratory testing, performing a physical exam, ordering imaging, and prescribing medicines to help you, such as antibiotics or antiviral medicines, such as Paxlovid for COVID-19 or Tamiflu for influenza. In addition, a doctor can send you to the hospital if it becomes clear that you need a higher level of care. Number 2, rest. We all need rest every day for every organ system in our body to function at its best. But when you're sick with a URI, you need much more rest than usual. So if you're sick with a URI, clear your schedule, avoid strenuous activities, and spend a lot more time in bed. This is great for your immune system, and it's also great because it gives you the extra time and space that you need to have an effective, speedy recovery from your URI. And finally, the number one thing that I want you to do if you're sick with a URI, drink lots of water. When you're sick, you need much more water than usual for every organ system in your body, including your circulatory system and your immune system. So it's important to drink a lot more water than usual. This isn't always the answer. If you suffer from serious illness such as end-stage renal disease requiring hemodialysis, or if you suffer from congestive heart failure, then getting extra fluid might not be the right answer, and you should see your doctor right away. But in the vast majority of patients, when you're sick with an upper respiratory infection, you want to drink much more water than usual. Aim for 5 glasses of water a day. Some signs that you're doing a good job would be if the color of your urine is clear or slightly yellow, and if you need to go pee frequently. Some signs that you are not getting enough water would include if the urine looks dark yellow, or if you get dizzy or lightheaded or blurry vision, especially when you stand up. So remember, if you're sick with an upper respiratory infection, drink lots of water, as this is the single most important thing for you to do to help to make a speedy recovery. That's it for today. Those were the top 10 things that I want you to do if you're sick with an upper respiratory infection. Thank you for watching. Be sure to subscribe and leave a comment below letting me know what health topics you'd like covered in future videos and if you have any questions. Remember that these videos are for education purposes only, so if you're sick with an upper respiratory infection, consider seeing a doctor. Bye-bye.